Hi, Martha. I'm Carrie, a student of occupational therapy. I'm here to bring you some information about type 1 diabetes today. So, when we talk about diabetes, it means that the body is unable to produce or use insulin effectively. This would cause the inability to maintain a stable blood sugar level, which remains at high level most of the time. Type 1 diabetes is considered as an autoimmune disease. This means that our immune system mistakenly attacks the cells in the pancreas and affects insulin producing. It's like a self-attack reaction in our body. Unfortunately, it is a life-lasting disease. However, there are plenty of strategies to help patients to live with it. Although this type of diabetes is one of common chronic disease for childhood, it can happen at any age. Actually, there are 50% of people are diagnosed after entering adulthood. When people have diabetes, they may find some behavior changes. 3 significant ones for type 1 could be peeing a lot, drinking a lot, and losing weight unpurposely. However, besides these, they may also suffer from easy getting hungry, blurry vision, weakness and fatigue, slowly healed stools, and easily infected than usual. Type 1 diabetes is relatively uncommon in Australia. Around 13,000 children and young adults had this disease in 2020. It is around 0.2% of the total population. And the prevalence rates remained quite stable between 2014 to 2020. It is also found that the indigenous children and young adults are 20% less likely to have this disease. The cause of type 1 diabetes is unknown. However, there are some suspicious reasons. The first is from genes. People with this type of diabetes often have siblings or parents in the same situation. The other reason might be the environment. Some researchers claim that when people are lack of vitamin D or affected by the virus, they may also got type 1 diabetes as well. As I have mentioned, even though there is still no methods to cure diabetes, it is possible to control it. However, if patients cannot manage it, some complications may occur. Low blood sugar happens quite common. It may be caused by the misuse of medications, having too much or too less insulin. Cardiovascular, chronic kidney disease, and hearing and vision loss may also happen after having type 1 diabetes for several years. Another thing that could lead to serious effects is nerve damage. The unhealthy nerve makes blood flow become poor, and which makes the sore ones, especially on feet or legs, get infected easily and hard to heal. When it goes bad, amputation is often needed to prevent the infection from spreading. It is worth noticing that when people have diabetes, not only their blood but also their saliva contains a high blood sugar level, which makes the mouth a hotbed of bacteria and further cause tooth decay, cavities, and gum disease. In addition, we should always be aware of Jessica's and you, the caregivers, mental status, because managing diabetes is never easy and actually quite stressful. Also, research already states that the stress hormones can affect the unpredictable rise or fall of blood sugar levels, which is not a good thing for diabetes patients. The 2 common ways to diagnose diabetes are checking blood and urine. In a blood test, we focus on the blood sugar concentration to see if it is too high. And we also check the presence of antibodies because it is autoimmune disease. So if these antibodies appears, then means something goes wrong. And also we check whether there are ketones in the urine because ketones are produced when your body burns fat instead of blood sugar for energy. So when this happens, the unused blood sugar will remain in the body, and which causes to the high level of blood sugar. To manage the blood sugar level, insulin shot is needed during the day to control the blood sugar overnight and between meals. This is what you and Jessica are already doing right now. And another important thing to do is regular check the change of blood sugars. As detailed as you understand these changes, as possible as you and Jessica can control the key elements that cause to the rise or fall in the blood sugar, and you can keep or prevent them. Lifestyle changing is also necessary to live with this disease. The general changes will be choose healthy food and exercise every day, and we will talk about that later. About diet management, it is highly recommended to have balanced meals containing protein, fat, and carbohydrate like rice or bread in one meal. However, it is better to choose low glycemic food like sourdough bread or whole wheat bread, brown rice, nuts, vegetable, fruits, milk. Also, it is better to have less processed food and less high-fat meals. Eating these kind of foods can delay the rising of blood sugar. The benefit of eating healthy is to help Jessica control her post-meal sugar level. However, research found that some children with type 1 diabetes may have poor linear growth, less weight gain, and unhealthy bone and mineral deficiency because of the over-restricted carbohydrate diet. So it is important for you to remember that Jessica has to consume adequate bread or rice every meal. It is suggested to have about 100 grams of carbohydrate every meal. Besides smart food choice, building the habit of exercising is important to Jessica as well. Exercise can improve insulin sensitivity, reduce risk of complications, reduce overweight, and increase mental well-being, which is truly helpful in maintaining this disease. However, researchers found that children with type 1 diabetes are less active than children of the same age due to the parents' concerned about low blood sugar and children not confident of themselves attending physical activities without feeling bad or fatigued. What we can do to help Jessica not to be affected by these barriers is that we can prepare some snacks for her to eat before activities or when feeling unwell during exercising. Also encourage her to try to do some exercise as well as providing compliments when she attends physical activities. Since Jessica spends most of the daytime in school, it is important for us to work with school staff and assist Jessica to well manage the disease in the school environment. First is to build a trusted and respectful relationship with the school, which is the base of all the partnership. Then share the health information routinely. According to other parents who have type 1 diabetes children, it is more efficient to contact timely and have regular meetings with teachers. By this way, parents can tell the conditions so the school can prepare in advance, and school can provide information so parents can discuss it with medical practitioners and find the solutions. Remember, don't just talk to school principal, but talk directly to the school staff who is close to Jessica because they can provide help in first hand. This is really important support for children with type 1 diabetes at school. In addition, have a medical ID accessory like necklace or bracelets would be really helpful for emergency events. So those who don't know Jessica's situation can provide assistance whenever needed. Now, here are some barriers and enablers of Jessica, which may help or prevent her from successfully managing the disease. Let's start with her personal factors. One of the barriers may be the condition of being excessively fatigued and having fluctuating blood sugar. Both of them will reduce Jessica's motivation of attending physical activities. However, experts suggest that children with type 1 diabetes and healthy children as well should better attend physical activities for at least 1 hour every day. If not, it can further cause to fail of symptom and condition management, which is one of Jessica's occupation after having diabetes. Since exercising is crucial elements of helping body to modify the blood sugar level, and without doing this, Jessica's conditions may go worse. She may have obesity or higher risk of cardiovascular disease, lower bone mineral density, and high rates of mental illness. Fortunately, Jessica loves playing basketball, which is a kind of aerobic exercise. So this kind of exercise is one of the recommended options to people with type 1 diabetes. So we can basically just encourage her continuing playing it and develop it as the habit of exercising. However, this may also be a barrier because high intensity activities like playing basketball can cause elevation in blood sugar level. This doesn't mean we have to stop her playing it, but we should always be really careful about her blood sugar changing after playing basketball. So another barrier is in the environment is Jessica's social support. So as we know, Martha is Jessica's mother is the primary caregiver, who is suffering from depression. So we may concern that the great parenting stress may aggravate her depression condition, which can lead to some negative effect to Jessica, which according to the research is that the unpredictability of the disease condition of the parents may lead to children have to be more aware and feel that they have more responsibility to take care of their parents and family. So, which can cause to the self-blaming, which means that they may feel that they don't help enough, or they believe the bad days happen due to their behavior. So, also they can face some stigma and bullying, and which makes them harder to build a friendship. However, there's still enablers in Jessica's environment, which is the supportive school staff. So they are really key elements to create the succeed of diabetes management and maintenance at schools. Research have found that the school staff, the supportive one, can check and supervise children to do her self-care properly, like measure the blood sugar and insulin injections. And they can remind Jessica when the blood sugar has significant change and provide help when she feels unwell. And also they play a crucial role to explain the situation that Jessica is facing to peers to reduce the misunderstood between them. For example, Jessica may have to stop and eat during the PE class. So others may not tease her if they fully understand the reason. So there are several occupations that may be affected by having the type 1 diabetes, but one of them would be the nutrition management. So there are reports showing that there are too many temptation of sweets and high-fat food in the school environment, which not only cause to the physiological issue, which is that if the children have them, then they will cause to the change in blood sugar. Also, it got some physiological issue. It causes physiological issues. If children with type 1 diabetes have reported that they feel sadness, they feel depressed, and even some of them have the food disorder because they cannot have any candies, but other peers are enjoying them. So this is the brief overview of type 1 diabetes and the challenges you and Jessica might face and some enablers supports that you have right now. If you have further questions, please don't be hesitate to ask, and I will keep working with you to live with this disease.